Hello, my name is Juan and I'm an EMT student. Today I will be performing a patient assessment and management for a 24-year-old female patient complaining of difficulty breathing. So first I ensure that my scene is safe by checking for any hazards. My scene is safe. Also don't I also use my PPE, including gloves and masks, to protect myself and the patient. Based on the dispatch information, the nature of the patient's illness is respiratory distress. Upon arrival, I see the patient is. Oh, shoot. I see my patient is seated. I see my patient is seated in a tripod position, indicated respiratory difficulty. She appears alert and conscious, so I assign on alert status for her level of consciousness. I introduce myself to the patient. Ma'am, my name is Juan. I'm with the ambulance. Can you tell me what's going on today? And she reports chest tightness and difficulty breathing. And I proceed with my primary assessment and with my ABCs. I check airway. I check the airway in the patient. The patient is able to talk and breathe, so airway is open. I check breathing. I observe her respiratory rate continuing to 24 breaths per minute. I listen to lung sounds with my stethoscope. Nothing wheezing and all. Lung wheezing. She has wheezing in lungs. And then I check for circulation. I check her pulse, which is present and around 96 beats per minute. I examine her skin for color, temperature, and moisture. Her skin appears pale but not cyanotic, normal temperature, and dry. And given the respiratory distress and wheezing, I immediately administer high flow oxygen via a non-rebreather mask at 15 liters per minute. I put the non-rebreather mask 15 liters per minute and verbalize this action with her. Hey, I'm gonna be adding this non-rebreather to you so it could help you breathe. And then next I perform a rapid patient history using OPQRST. I'm gonna tell her symptoms started about 1 hour ago. Provocation started while watching TV, no physical exertion. Quality describes the chest tightness as severe. It does not radiate nowhere else. And it's an 8 out of 10 from 0 to 10 on difficulty breathing. And symptoms started an hour have been going on for an hour. Then I gather my sample history. She's allergic to penicillin medication. She's currently using a albuterol inhaler. Past medical history. She's diagnosed with asthma. Last oral intake, she ate breakfast this morning. Events leading up to this, she was sitting and watching TV. Then everything started happening. And then we move to our second assessment. I'm gonna reassess lung sounds after oxygen administration. Wheezing persists, but the patient reports some relief and easier breathing. I then take vital signs. Her pulse is 90 beats per minute. Her respiratory rate is 20 breaths per minute. Blood pressure is 112/70. My field of impression in the patient is experiencing an acute, a little asthma attack. If available, I would assist her with her albuterol inhaler as per protocol. I prioritize rapid transport and prepare to hand of care to ALS providers. Upon their arrival, I provide a thorough report. So I tell them this is a 24-year-old female with difficulty breathing, history of asthma, currently wheezing on high flow oxygen, Vital signs are all stable, no cyanosis, allergic to penicillin, and symptoms started 1 hour ago while at rest. Throughout the assessment, I monitor every 5 minutes the patient's condition and remain prepared for any changes. This concludes my patient's assessment and management for this scenario. Thank you.